Welcome, everyone. Thank you so much for tuning in, all of you loyal listeners. You're listening to your favorite radio show, the Cherilyn Lee Health Show. And now, your favorite radio host, Dr. Cherilyn Lee, PhD, NP.
And thank you so much. Thank you so much, Belinda Foster, who is a PR specialist. I want to thank you very, very much, and who is also the co-host of the Cherilyn Lee Health Show. And we have a wonderful topic because there's so many millions of people affected by this condition and don't even know it.
Yes, and our topic today is part 2 of a deeper look into thyroid and autoimmune symptoms, and my lab test is normal. We have a wonderful guest today. He's a medical doctor and a board-certified one at that in holistic medicine and anti-aging. Please welcome once again Dr. Robert P. Mathis.
Good morning.
Good morning, and thank you again for tuning in with us. Thank you.
You're welcome.
Thank you for being a guest. Thank you so very much. And so for lack of time, and you have so much information to share, when we left off with part 1, we had quite a few questions, but I prefer right now if we just do a recap of last week.
Okay, we're going to start with where I was. The classification of types of problems that could have an impact on thyroid. Number 1 is nutritional. It's important that we get our nutrition. If the nutrition isn't in the food, we may need to supplement. And we need to supplement with products that actually work. We talked about that last week, that there are products. I've noticed that different products have different efficacies or ability to help the person. I had a number of patients that called me and told me that product A didn't seem to do much for them. They've been taking multivites their whole life, whatever. I give them the multivite that I have available, and they call and say, I feel the difference. So these products aren't created equal. We just need to be aware of that.
Right. And I'm sorry, could you say that one more time? Was that multivite?
In that particular case, it was a multivitamin.
Okay.
In another case, it was the betaine hydrochloride. In another case, it was the CoQ10. In another case, it was the vitamin D. Basically, all the products that I have available, I've had people call and tell me that they've noticed that there's a difference in the products that I have available compared to what they buy at wherever, which could include Costco, Kmart, so forth and so on. So the drugstores or even at the health food stores, it's just important to become knowledgeable that not all nutritional products are created equal. Not all companies have the same fastidious nature about putting their products together. So you can call them and ask them, do they do various types of testing? Are they sure the products are free of heavy metals and toxins and biologicals, in other words, bacteria, fungus, yeast, so forth? I mean, there are companies out there that really do want the cleanest product they can provide to the public.
Yes, they do. And it's important. And I'm so glad you stated that because most people keep telling me or come to the clinic, I'm sure, as they come to your clinic, and they'll pull out, their bag of things that they're taking, which is usually a nice big bag, and say, well, I got this over here at this store, this over there, and none of this stuff is working. And so I'm so glad that you're re-emphasizing on that.
Well, I already take CoQ10, and I say, okay, well, you haven't tried this brand, and they say, well, no, but I take it, and so really, it just helps them understand that if they would just try a different, like for example, one of the brands that I have, I mean, they're available. I mean, there's nothing special. It doesn't come from another planet. It's just a company that has more. Puts more love into their product because that's what they want to do. It's their choice. And these products are more available. They're more absorbable. The multivites are citrated multivites, which are very easily absorbed for just about anybody, as an example. So anyway, just keep that in mind. The second area that we talked about briefly was toxicity. And it's important to understand that toxicity, the environment is surrounding us, and today, as of the last 15 years, we're becoming more inundated with various types of pesticides, herbicides, chemicals, plasticizers on a daily basis. And there's outgassing of new carpeting, outgassing of drywalls, there's outgassing of plastics, there's bromine in the laptop, bromine in the keyboard. There's bromine in the new cars. One of the stories we heard from Dr. Brownstein, who's a iodine expert, he had a patient who had been very toxic from her metals and including the bromine. She was high in bromine. So he worked out a program protocol. She was cleaned up. She was out for about 2 or 3 years, and she came back. And she said, well, Dr. Brownstein, I think I'm getting worse again. So he said, what's changed? And she said, well, let's see. Married to the same husband, okay. Live in the same house, okay. No new carpet, okay. No new draperies, furniture, okay. And he said, well, what else? She said, oh, I have a new car. Oh, really? Okay, what'd you get? Well, we got a new Buick. So when he did the research, he found that the steering wheel, the plastic in the dashboard, and the leather seats all were treated or processed with bromine or chloride. And it's this bromine, apparently for her, she's very sensitive. So his attitude was, well, I think you're going to have to give up the car so you can feel better. So he put her on a little protocol, and she actually decided to exchange cars with her husband. She gave him the new car, and she drove the old car, and she felt much better.
Oh my goodness! So how is he feeling?
Huh?
How is he feeling?
Well, here's the irony of medicine itself: is that
yes.
He may not notice because he may have a better metabolic process to excrete bromine than she does.
Right. Okay.
He may be able to drive that car for a longer period of time, or at some point, and of course, that's a relatively new story. That's only about a year ago, so he hasn't been in the car very long. We'll see. We'll see what happens.
Okay.
So, I had a woman once who was telling me that she was heating the baby bottles in the microwave. I said, well, is the bottle made out of... Yeah. I said, is the bottle made out of plastic or is it made out of glass? She said, oh, no, it's plastic. And I said, ooh. I said, you're heating your baby plasticizer because when you heat the bottles, the plasticizer comes out of the plastic into the BPAs, and so they come out of the plastic into the baby. So we want to stop that right away.
Yes, we do.
As I talked about last time, that there was a study that showed that roughly 270 chemicals are found in cord blood in newborns.
Yes, it is.
So
yes.
Our newborns are already inundated with chemicals before they're even born. So this is something that can stop. It's a matter of personal choice that we as consumers can simply make a decision not to purchase certain products. That once the awareness, once the learning has taken place, such as with this wonderful show you have, people can learn about these things, and they can make their personal decisions. They can go online and study. They can send you or me emails, ask us questions about things. I mean, this is how we learn. And once we know, then we have to move into an area that's safer. This is just how simple it is.
Yes. You brought up this point, and I had a patient that, actually two, but one in particular had some bizarre symptoms with her lungs. And I know her personally, and I'm thinking that she was fine before she got this car accident. So I was really curious as to what's in the airbag, because her airbag, she had a car accident, the airbag deployed.
There it is.
And she inhaled all of these fumes, or whatever, that white powder.
Yes, the dust. Mm-hmm.
In the dust. And then I spoke to another doctor who was telling me, who was an environmentalist, who was telling me that the toxins in that dust is so toxic to the lungs and heart that it even can precipitate a heart attack. Do you know about that? What's in it too? I mean, not so too, but
we learn from each other.
Yes, we do.
You're teaching me about the airbags, and I think I talked about. I'm not sure I did, but I can talk when we get to the autoimmune section. We'll talk about the young girl who, at age 23, had Graves' disease.
Yes.
So we tracked her history back, and we got to the age of 16 backwards, and we found out that she went with 50 other children camping up in Big Bear here in California, and they had a campfire at night. The next morning, 50 kids took off on a bike ride. 13 children went to the hospital. 2 of the children didn't leave the hospital. Now you're asking yourself, why would 13 people go to the hospital after a bike ride?
Yes.
I mean, this is just a bike ride. The answer is that wasn't a plain bike, something they rode through, a plume of some kind of toxin, or possibly somebody threw something in the fire that night, and those kids were on the downwind side of the fire when that plastic or whatever they threw in the fire burned and maybe gotten into their lungs. I'm not so sure. We never really could figure it out exactly, but we believe that something happened at that point, and she was one of the children that didn't leave the hospital, and the 13 kids that went to the hospital complained of respiratory issues, and then down the road about a year later, she developed this Graves' disease, which she suffered with now for about 5 years. The family decided to, instead of removing the whole thyroid, we struggled for years trying to balance it out. We gave her hormones. We gave her a little bit of the Tapazole to help calm down the thyroid. It seemed to work okay, but we never did really get much control over it, even with strict dietary regimes to help reduce autoimmunity, to help reduce the production of these antibodies. We still couldn't do it, even with inflammation. Tried to turn that down. So they ultimately took out 1/3 of the gland, or 2/3 of the gland, and left a third at the disagreement of the surgeon, and they showed him some papers. And the idea was that if they leave a third of the gland, there's a chance that might, because they took out so much, it may extinguish the disease, and maybe she could live on that 1/3 of her gland. So we'll see how she does. That was just, surgery was just about 6 or so months ago. So we'll see.
So I pray she make it through it, too.
Yes.
Everything works out well for her.
Well, she just had a baby, too, which is interesting. So that's another. She got pregnant during this last year, and the baby's doing well, and there's some issues there, potential issues there, but apparently everybody's doing okay.
Oh,
so
great.
We talked about autoimmunity, and we have to remember that autoimmunity can be caused by the toxins, the chemicals in our environment. Autoimmunity can be enhanced by stresses. We'll talk about stress shortly, because high levels of stress, whether they're interpersonal stresses, job-related stresses, illness-related stresses, these high cortisol levels causes some damage to various parts of the brain, which then cause dysregulation of hormones. Hormones are really important in terms of health. People who are missing their hormones or who have hormones suppressed, there is a good chance that they're going to medically go downhill, because the hormones help keep them as healthy as possible. I've seen many women come in premenopausal, perimenopausal, or menopausal, go on hormones, and their whole life starts over when they add the estrogen, the progesterone, and then when they add the testosterone. Or even a little thyroid can make such a big difference in a person's life. So the autoimmunity, largely the Hashimoto's disease, apparently is largely connected to the consumption of gluten products, which would be the wheat, oats, barley, and rye. There's a number of cross-reactive foods we talked about briefly, which has...
Yeah, could you repeat that again and speak up just a little louder? Your voice seems like it's getting a little bit lower, and I want our listening audience to hear everything very, very closely, because it is so important that they understand, because you mentioned some gluten foods on our last show that I want to kind of, make sure that they're very clear and people understand them. And maybe sometime you don't have to do all this lab testing, because there are lab tests that you can do too. But
there are tests to help to confirm this, but for those of us who don't have a lot of cash, we can even just do an elimination diet and find productive results by just doing that. So Dr. Aristo Vajani developed these theories and these ideas after many years of research, 44 years to be exact. Basically, his mother had severe arthritis, and as a child at age 9, he was very unhappy that his mother suffered, and he wanted to understand why. So over his lifetime, he's understood. In this case, he's understood the relationship between wheat, oats, barley, and rye, and gluten and gliadin, the water-soluble form of gluten, and how these products actually cause inflammation in the body. If you read the book called Wheat Belly, you'll get the impression that wheat originally had 12 chromosomes. As time has passed, it has been genetically modified either chemically or with radiation, or different techniques are used to genetically modify food. Monsanto has a technique, and there's other techniques. So this modification has produced 48 chromosomes in a product that had originally 12. with so many chromosomes, it's just difficult to say what types of products and proteins are produced by the plant after so many generations and so many changes in the chromosome base. And that probably is largely why the genetically modified foods can lead to antigenicity, or in other words, autoimmune disease. So the wheat, oats, barley, and rye, and there are many cross-reactive products. How cross-reactivity occurs is because the receptor that's produced by gluten is a physical structure that can actually accept other proteins. These other proteins can include proteins from sesame, hemp, rye, barley, Polish wheat, buckwheat, sorghum, millet, smelt, amaranth, quinoa, yeast, tapioca, oats, corn, and even coffee, proteins in coffee. Now, not everyone has this problem, but there are a number of patients that I've tested with the Cyrex laboratory, CYREX labs, and I have found that there's a number of the patients that are quite positive to these cross-reactive products, myself included. So when I stopped gluten in August of 10, the first thing that happened was my neuropathy went away. Second thing that happened was I had a withdrawal period of about 3 days where I was really angry and nasty because the gluteomorphine and the caseomorphine from the dairy products is a morphine-like peptide. And basically, when you get off of gluten, it's like you're withdrawing from a morphine-like product if you, in fact, metabolize it into that gluteomorphine. Not everyone does.
Oh, my goodness.
Yeah. So for about 3 days, I was the angry guy. And the patients and my staff were saying, well, Dr. Mathis, you're just not yourself.
Yeah. I'm sure they did say that. I don't think I called you during that time.
Oh, yeah, I was offering apologies for 3 days. Then I became a happy self after that. The next thing that happened, as I explained in our last lecture, was that I have an 82-year-old, and about 2 months into her elimination diet, she developed terrible hip pain and wrist pain and arthritic pain. And I told her that's the antibodies of the gluten going after your tissue proteins. So this is called molecular mimicry, and what happens is this is how thyroiditis, Hashimoto's thyroiditis or Graves' disease, this is how these things happen because these receptors can accept other proteins that look similar to the sesame or the hemp or the quinoa or the gluten. And so when they accept these other proteins, which could be a body protein, now you have autoimmune disease. And it happens that if a person turns down their consumption of these products, especially dairy and grains, that you'll actually see a resolution and a decreasing of the presence of the antibodies. I've even seen ANA go from positive to negative, which is anti-nuclear antibody.
Right.
I've had the patients come and tell me that they just feel that much better, and maybe the testing doesn't go negative, but they feel the difference. So they're above the threshold for symptomatology.
So yeah, you named so many wonderful foods like the quinoa and different things, and the hemp, because a lot of people I know have switched over to hemp flour or hemp, for protein. So what's left?
What's left is option A is you have to do a test to see if it cross-reacts with you. If you do the test, so I did this array number 4, which is the cross-reactive food test, and that was really a depressing day when I got the results back because for me, I can't eat any of those foods. I came back positive on everything. So for me personally and for a number of my patients, they really have to just abstain. I have a number of patients who came back positive on the dairy, but they could consume various grains, and it had maybe 1 or 2 of the grains they were positive. So it's important that if you really have, you can start by just eliminating, see how you feel. Then you can bring back 1 food at a time for 3 days. And for that next 3 days, you only eat almonds, you only eat quinoa, you only eat tapioca, whatever. And the idea is within that 3 days, if there's a reaction, the antibodies will be regenerated and you will become symptomatic. And if you don't, you're probably okay with that food. However, we must remember that symptoms only occur, in my impression, after about 80 to 85% of loss of function. So when you lose that much function, that's when the symptoms seem to come through.
And
Other than
that's
that,
a lot of loss, 80 to 85% before you even have a symptom. That's why so many things are kind of under the heading is silent killers or silent conditions, because you could never have a symptom until later. Yeah.
I know. I have a person who has, he came into the office for an evaluation, and right before he left, he said, I forgot to tell you. I said, what? He said, well, I only have one kidney. I went, okay. Let's do a 24-hour urine and see how much kidney function we have left in the one kidney. So considering 100% is two kidneys, he only has 50% function out of the gate because he's already missing one kidney.
Yes.
Now we did the 24-hour urine, and we found out that came back at 75. The range is 125. I think it's 100 to 125 is the range. So he came back with a 75. Actually, I'm sorry, he was 47. Oh, geez. So he's very low kidney function with one kidney left. So he's about, on the 100 scale, he's probably about 22%, 25% left. And I said, you can live the rest of your life on this if you're careful. But you will not be taking any more dye from the doctors when you go to get those radiology studies. I wouldn't touch the dye ever again. I would be very careful about antibiotics.
I'm so glad you're saying that, because so many people call and they want to know should they do that. And I tell them, I mean, you sign a very in-depth consent. And people don't read it. I mean, if you read that consent, you wouldn't want to do it anyway.
Yeah.
Yeah, because it's pretty in-depth.
It's just important to be really careful. I mean, if you're going to do something, make sure you understand what it is you're doing. Postpone it until you've had a chance to talk to your provider, talk to some of your other friends and consultants, and try to get some idea of what's going on. Number two, you may want to test the function of that particular system that's going to be stressed by this test. And if it's going to be a dye, you get those kidneys checked. And you find out, you ask for the 24-hour urine, and you find out what your filtration rate really is. Can you afford to lose 5 or 10% from the dye? I had a patient go in. She is a severe diabetic, and she had some chest pain. They wanted to do a catheterization for the heart. They wanted to use the dye, and I told the cardiologist, said, as soon as you give her the dye, you're done. She's going to go right into kidney failure. She had like 7 or 8%, 10% left. She was just hanging on the edge. And as soon as he did the dye, that was it. She's now on dialysis. He killed the kidneys. So it's a trade-off. Did she really need to have the procedure? Could they have done something else? Well, anyway. So now she's on dialysis, which
I know. And that business is just booming. I mean, the community where I am and driving through, there's so many. I'm actually sandwiched between 2 dialysis centers. And the sad thing about it, the paramedics are here every day.
Yeah,
every day. It's so sad to see that. So it's like, why are so many people going into kidney failure?
Well, we basically brought up the topic of toxicity in the environment, which is probably part of it. Number 2 is going to be nutrition. Number 3 is going to be lifestyle. So let's talk just for a minute. But let me leave autoimmunity. One last comment.
Okay, go ahead.
It takes about 120 days for the half-life of the antibody. So in 120 days, the level will go from 200 to 100, so to speak, and then another 120 days for it to go to 50, and another 120 for it to go to 25. So basically it takes about 12 months for this reaction to slow down to the point where they get a lot of relief from their arthritis. In the meantime, they may want to go see the rheumatologist and get some drugs, but the answer is those can cause terrible flares. They can be problematic. I'm not sure I would do that if you can hang in there. But you just have to work with your provider and make these decisions along with your provider.
Trust a provider. I just don't want to cut you off. And not going to find all the answers on the internet, because sometimes that can get you in trouble.
It's important to work with a provider
that
you trust, that you feel is keeping up with the times, because there is a lot of information available and there's a lot of boundaries. In other words, the alternative physician is really quite a different person than the allopathic physician. So it's important to just remember that, and also remember that I know that everyone means well. So first of all, we believe that everyone means well. They do the best they can. But there's no replacement for continuing education on the part of the providers. So just so we know that. Now, we talk about stress briefly. Now, none of us we don't give a lot of weight to stress, to emotional, psychological stress. And I would say this. I would say that I would rather be run over by a car than abused by a loved one or harassed by a boss. I think
Please say that again. My goodness, that was pretty drastic. Say that one more time.
I'd rather be run over by a truck than be abused by a loved one, or be harassed and victimized by a loved one, or be rejected or have the love taken away from me by a loved one. It's just the power of the emotions can change the whole body structure. The power of emotions can destroy a person. Yes.
Dr. Mathis, that should be on a T-shirt, and I would buy it.
There we go. Listen, you're going to get up from that car. Oh, wow. Are you okay, sir? Yeah. My leg is broken, but I'm okay. I'll heal. But when someone is abusive, when someone is molested as a child, when someone is aggressively damaged by an unhappy person with emotional abuse, you know what? I'm not sure some of that's reversible, or it might take years to repair.
6 years.
That.
Yes.
Oh my God! And that's with advanced therapies and all kinds of different fancy things to try to get those emotions out, because these things are programmed into the brain, and the brain is this powerful device that can actually run the whole show. So stress is real, and we have to try to manage our stress and manage our lifestyle to reduce our stress. I have told several patients, as I'm sure all providers have done this, they say, well, Mr. Smith, what time do you go to work? Oh, I go to work at 5 p.m. Oh, I see. What time do you get off? Well, I get off at 5 a.m. Okay, what do you do then? Well, I drive home and probably stay awake. Maybe I get a couple hours of sleep in the afternoon. I'm going, wait a minute. What's wrong with this picture?
Yes.
There's no sleep in here. First of all, they're off the rhythm of the planet, number one. So they're losing all their melatonin spikes that are supposed to be occurring around, between 9 and 12. So all that anti-cancer that comes from melatonin is not available. And the shift workers and the flight attendants are the two groups that have the largest amount of cancer because of this loss of the melatonin surge that occurs. Okay. So it's important to get your rest on time. And number two, the 3 pots of coffee and the 2 packs of cigarettes you smoke, they said, Mr. Smith, how am I supposed to help you unless you change your lifestyle? I said, if you're going to really do this right, you're going to come home and turn yourself upside down. He said, what do you mean? He said, well, I went to this zoo down in San Diego, and they had a building full of the nocturnal animals. And they literally turned it upside down. In other words, night was day and day was night. Well, you got to do the same thing. When you come home, the house is black. It's almost like you live in Alaska. You got to black out all the windows. You got to pretend like daytime is really nighttime for you, and your daytime is night for everybody else. And then you'll be able to have some kind of health. At least you're going to be in some kind of synchrony. All right. Anyway, enough of that idea.
No, that's actually true. I tried as a nurse practitioner, working in hospitals years and years ago. I actually tried because I thought I could do a graveyard shift, that 11 to 12 midnight. And what happened, it just threw me off so bad. I had the worst cold, and I never had colds even back then. I couldn't shake it. And I actually just lasted 3 days, and I had to quit because I could never go to sleep.
Right. That's number one. Number two is, had you done it for a period of time, your hormonal rhythms would have gone off. And as a female, those rhythms are essential for health. They help prevent autoimmunity. They help prevent the thyroiditis. The estrogen is a lifesaver. Estrogen also raises the serotonin level and keeps women calm. So the first thing that happens when I restore hormones is the anxiety lifts, and women become much more stress tolerant. I had a lovely 42-year-old come in. She was in basically menopause, and she had 3 kids under the age of 8. We gave her the hormones, and within a month or so, she felt so much better and could manage the children. And she also decided that she needed her husband again.
Okay.
So she was looking for him. And then he calls me up and says, "Thank you for saving my marriage." So it's important that we don't allow ourselves to become adrenally exhausted. I was talking with a patient yesterday, and she said, "Oh, no, I'm not tired." I said, "Okay, well, what do you do?" She said, "Well, I have about 6 cups of coffee a day." I said, "How many?" 6 cups of coffee per day. I said, "Oh, well, of course you're not tired. You're not even going to know if you're tired."
Yeah, you're just running on pure adrenaline.
Yeah, she's like just got the juice flowing there. That's it. She's not going to know. So I said, "Why don't you just stop the coffee for a week? Call me and let me know how you feel." Well, of course, I know she'll do it, but I said, "What do you think I do with patients if they have abdominal pain? I send them home." I said, "Okay, don't take the pain pill before you go to bed. Let me know how you feel at 10 o'clock. And if the pain is horrible, crushing pain, you're in the ER.
Yeah.
And if it's not, then go ahead and take your pain pill and then sleep tonight. Wake up in the morning, don't take it, call me." And then they say, they call me in the morning and say, "No, it's a lot better." Okay, or if it's bad, I say, "Okay, you're in the ER. Because we're not getting this, there's something going on serious. But when you take the pain pills, it covers it up. When you take the coffee, it covers it up." You need to know what your body's doing. I had a woman come in the ER once. She had terrible lung disease. And she just basically came in the ER, and 5-6 days later, she died of this adult respiratory distress syndrome because her lungs were just gone from functioning. They couldn't function at all. And she didn't know because she never exercised a day in her life. She had no idea of her functional capacity because she never tested it.
My.
Go outside, take a walk, and see how you do. Walk up a hill. And if you really get winded and you're out of breath and you feel kind of like, okay, this is embarrassing, then that means you probably should do something about that. If, on the other hand, you can walk up the hill and you feel pretty good, then you're stressing the range of function and you can just see how you do it. So it's important to know what our capacities are, and the only way to tell is by not supporting them with stimulants, for example.
Exactly. And I like to kind of still go back just on the sleep, that's going to bed at 9 p.m. What is it, 9 to 12 p.m. in order to...
Basically, yeah, you want to be on planet time.
Planet time.
Planet time. If you look at the studies, what you'll see is cancer came to the farmer's lab. Oh, wait a minute, what you talking about now? Well, it turns out that the invention of the light bulb provided a little more opportunity for cancer because melatonin got extinguished because the lights are on. And it turns out that the farmers got electricity last. So when you looked at the studies, you found farmers were the last people to start getting cancers, literally because they just didn't have the light. They went to bed at dark and got up when it got light.
Yes.
They were on planet time.
Oh,
so
my.
there it is. Interesting.
Make a lot of sense here. And
the book is called Lights Out by T.S. Wiley. You can read that book, and it's after I read the book, I said, "Oh my, I'm going to bed at 9."
Then I'll make sure I never call you after 9 o'clock at night.
Well, I didn't last long, but I tried it. So for 2 weeks, I went to sleep at 9 o'clock, and I never got up at 6. And I felt so good because the body is designed with 10 million years of evolution. Okay, or at least this is how the cycles are programmed. However you want to believe, the cycle is programmed for a certain cycle of time and in relation to the planet and the moon and so forth. So if we do this, we gain. And if we don't, we start to lose. And that's when we lose control of the adrenals. When that hippocampus is damaged by high stress levels, we lose the ability to down-regulate cortisol at bedtime. That's why we feel so energetic at 10:30, 11 o'clock at night. Time to go to work. No, it isn't. It's time to go to sleep. But you feel like you get the second wind. Oh, is that what that is? No, it's actually damage to the hippocampus from the long-term stress, and the adrenals start to run wild, and if you do the testing, you'll see the numbers go up at night, when they're really supposed to be as low as they can be.
Yeah, well, I used to be that person. I'm like, oh, no, I feel great at 10, 11 o'clock, so I just keep going.
Right.
Yeah, and a couple times I crashed too. Not in a good place.
Right.
Yeah.
So remember that stress is underrated. We need to realize how important it is and how important those interpersonal relationships are, and try to find a good one. If you don't have one, then get a good one.
Yes, yes.
All right, or work it through. Divorce. I hate divorce, but if you just start talking. Find a way to start talking. That's the most important thing of all. Keep the communication going. Number 2, get the hormones looked at, because women tend to run low on hormones in their 40s, early 40s, even sometimes before that time. I have women walking in at 23 that have no estrogen.
No.
And no wonder they're a little depressed. They don't want to go to college. They don't want to do any work. I mean, no wonder, of course. So you give them some hormones, and they feel much better. It's a shame. The question is, where those hormones go?
Right.
So on this topic, we're going to talk about things like electro EMF, which would be Wi-Fi, cell phones, cell towers, smart meters, cordless phones, and microwave. What's that? That's another form of pollution that can resonate with cells and actually cause some cellular changes. There are many studies out there about cell phones and about the risks of cellular changes in cell phones. I know of one lecture I went to where the doctor spoke to a woman who put the cell phone next to her left breast in the bra there, and she wore the Bluetooth on her ear. And it turns out that she had a tumor after a year or so right underneath that where the phone was placed in the breast tissue in an unusual location. I have people who have, I have a couple of patients who have little marks on their cheeks. There's 2 little red marks in the cheek from hyperpigmentation of the cells of the side of their face from where they used to hold the cell phone.
Oh, my goodness.
And that isn't really necessarily going to go away. So I have a couple patients like that, and I said, okay, we'll get a headset, start using a headset, and that'll reduce it by 99.99 whatever percent. And, of course, in France, I believe they've outlawed cell phones for children under 12, I believe it is. They can't use, so they're not allowed to have a cell phone because the brain, there's so much water in the child's brain, and the child's head is so small that the radiation from the cell phone crosses all the way through the whole head of the child. And there's 2 effects that cell phones can cause. One is the EMF, electromotive force, and the other one is the heating effect, like a microwave. And the heating effect is just as damaging as the electromotive force. So hormones are very important, and try to reduce. I don't use Wi-Fi. I just don't have it in the house at all. And because I've already got about 6 of them around me, that I didn't give them my permission to radiate me 24/7.
Oh, yes, I know.
So here,
They'll do it.
if you go to antennasearch.com, type in your address, and what you'll find is how many cell towers and how many cell antennas are near your location.
Okay, give that website again and a little bit clearer, because I want people to make sure that they do that, because that is so important for you to know.
AntennaSearch.com. And if you go to AntennaSearch.com, which I presume is still there, and type in the address where my office is, there are 44 antennas, or 44 towers, sorry, 44 towers, and 366 cell antennas that are within a 4-mile radius of my office.
Oh, that is
40
that is
towers.
frightening. That is so frightening.
A friend of mine has a property in Utah, and we did antenna search, and there are 2 towers and 4 antennas in Utah where his property is. So the answer is it's really quite different. Here in my city where I live in Carpinteria, there's I think it was 9 towers and was it 4 towers and 36 antennas, something like that. So even in a tiny town, there's just a ton of them.
And it's sad that you really can't. We don't really have a choice. You can't fight as a community or to your government that you don't want these towers around your house. They're just put there.
I think that the answer is it's a matter of education and awareness. And at some point, people can form coalitions, groups.
Yes.
And letters can be written and generated, and through that democratic, quote-unquote, democratic process, we can try to figure out a way to deal with this. The problem is you have a $5 billion industry that is supported by those antennas. So
Oh, yes.
it's going to be a challenge the way you look at it.
So what do we do then to safeguard ourselves? Because we
All right.
have
Well,
we know we have the environmental, we have the EMFs, we have all the pollution. So what do we do? Because I know what I do to safeguard myself and my patients. But
all right. So,
Dr. Mathis, I want you to share what you do and tell us how do we, because we don't want to leave people feeling gloomy after the show.
That's
There
right.
is help.
yes.
There is help, and one more thing for those of you just tuning in, you're listening to the Cherilyn Lee Health Show, the health radio show at innerlightradio.com, and you can also listen in at www.thecherinleehealthshow.fm or www.drcherilynlee.fm, and callers can call in at 310-928-7733, or you can email us at innerlightradio@yahoo.com.
All right. So we're going to talk about solutions now.
Okay.
We're going to turn it into a positive solution, positive end to our wonderful lecture here. All right. Number one method for detoxification. Number one method. Eliminate the exposure.
Okay.
What does that mean? All right. So number one is you select your grass-fed products. You select the organic products. You basically are applying a personal pressure to the industry to provide those products by buying those products. That will cause a big change. Number two, if you want to slow down the EMF, for example, there are paints available that you can paint your walls that block the EMF, the cell phone
really?
towers.
I didn't know that.
You can buy screening material that goes over the glass that blocks the EMF. If you want to, you can actually buy a small version. You can buy a little tent that can go over the bed, and this silver impregnated cloth that you put over the bed as a little tent or screen you can sleep in the tent and block all the EMF. So while you're sleeping for that 8 hours, you're good. Number two is you can pick up a device that measures the energy around the house, and you can try to position the bed in a place where there's less EMF. You can put the computers in the other room. The bedroom should be a place where there is no electronic devices, not even the little clock on the electric clock at the bedside, because it has EMF to it. I mean, this can get extreme, and I understand that. And the answer is not everybody is as sensitive as some people are. I have some patients exquisitely sensitive. A lot of us are not that sensitive. It doesn't mean it's not having an effect. It just means that we're not as sensitive to it at the present time.
Yes.
So if you want to eliminate these things, this is all very possible. I even have a point where people will go to the extreme where they'll actually turn the power off in the bedroom. They just flip the switch. And then there's no electricity running around the room. They move the head of the bed away from the outside electric block on the outside of the house. They put the bed on the other side of the room. If there's a big power block on the back of the house where all the wires come in, put the bed on the other side of the room. I mean, this is all education from environmental medicine classes I've gone to. They help explain, unusual cases of children, for example, that have had emotional changes. They move from house A to house B. When they get to the house B, all of a sudden all these changes occur over a 3 to 6 month period. It's unexplainable what happens with this child at age 14. What happened? Turns out that the kid's head was right behind the master panel of the house, and as soon as they moved his bed to the other side of the room, it all went away.
Amazing.
You're just thinking, oh, how can this? Is that real? And the answer is, yeah, that's a real person. Oh my God, that had a problem. The parents, of course, are going crazy. So there are solutions.
Yes.
For example, if you want to kind of reduce your blood pressure, your diabetic risk, you can do a little fasting from time to time. A water fast for a day is certainly not a problem. I mean, you have to work with your provider, but these are ideas. I've sent people to fasting clinics before. 1 or 2 patients went to the True North, which is up in Northern California. One person went up there. He lost 42 pounds. He lost his blood pressure. He lost his diabetes, and he lost all of his pills.
Wonderful. And not on the plane. I'm just kidding.
He was Mr. Clean when he came home.
Amazing.
He had like a complete reset of his whole body functions.
Yeah,
lifestyle.
And I've seen. Mm-hmm.
Lifestyle. What is lifestyle? Well, lifestyle is some of that thing we talked about, going to sleep at a reasonable hour. And trying to have a schedule that you can live with. I mean, how can you go to work full-time, raise a 12-month-old baby full-time as a single parent, come home and do night classes on the computer full-time, and have a life? How do you do that? I mean, I ask the person, you should not be going to school, right? The baby needs you, first of all, number one. Number two, you shouldn't be doing school. You need to be sleeping. When the child's asleep, you need to sleep because you're a single parent, and if you don't sleep and that baby's asleep, you're not going to get any sleep.
Yeah, and forbid that they're putting the computer on their lap.
So she doesn't sleep, and then lo and behold, her hemoglobin A1C starts to climb up. She's starting to go into the pre-diabetic phase, and then over the next year or two, she'll end up in the diabetic range because this lack of sleep produces a lot of stress in the body, raises the cortisol level, raises the blood sugar, raises the insulin, and before you know it, she's got insulin resistance because the body thinks that there's some crazy thing going on. It can't tell the difference between a dinosaur and emotional stress. It can't tell the difference. You can't tell the difference between the dinosaur coming at you and the emotional stress of trying to live that lifestyle. Hydration, very important.
Yeah, I was visualizing that myself, not to the point I want to get stressed, but that is so true. I like that scenario too.
Well, there you are. I mean, we just lifestyle. I mean, I've suggested to patients from time to time, as I do, and I listen to the stories, and I just say, okay, what's wrong with this picture? And they go, what do you mean? Well, you can't drink, 7 cups of coffee and then go home. I had this one patient come in. He's a dean at a university back east, right? And he tells me, he says, I've had 3 of these episodes. And I said, what do you mean? He says, well, the latest one was about a couple months ago. I had this global amnesia. I went, what? Global amnesia for how long? Well, he said, well, about 6 hours. I couldn't remember my name. I didn't know where I was. I mean, I was just lost. I said, oh, okay, well. I said, what do you do? And he said, well, I have about 5 or 6 cups of coffee during the day. And I said, okay, that's dehydration. And then I go home and I have 3 or 4 glasses of wine or even a mixed drink at home every night. I said, that's dehydration some more. I said, you got yourself so dehydrated, I'm surprised you haven't had a kidney stone. I'm not surprised that you've had like some kind of a stroke because you're so dehydrated that you're going to have any little vascular space that would say had a size of say 10. Now with that dehydration, it shrinks down to maybe a 5 or a 3. My brother went to an urgent care in Illinois to get a medicine for his cold. The doctor said, "Oh, by the way, you have a little blood pressure. I'll just give you this water pill." So he goes home, and 3 months later, he has a stroke. So they do the studies on his neck, and they find out he's got this little plaque in his artery in the neck. And by giving him the water pill, they dehydrated him and made it so that the size of the artery shrunk because there wasn't as much fluid in there.
Oh my goodness!
Literally, and so that little plaque turned out to be a huge plaque by the time they dehydrated him.
Oh my!
So now he's got a permanent speech loss because they gave him a water pill. And in his case, nobody ever checked his neck. Why would you? Because there's no symptoms. When do you get symptoms? When you've lost 80, 85% of function. And then it's often a little on the late side. So maybe had they done some kind of a carotid ultrasound, maybe they would have seen that. And then maybe they wouldn't have given him a water pill. But, of course, it's all matters is how you think about these things. So there's an idea.
Right. We have a question.
Sure.
We do have a question from a Dorothy J. Oh no, I'm sorry. I should have put on my glasses here. We do have a question about carbonated sodas. Do they dehydrate the body?
Well, I don't believe so. No.
Do they hydrate the body? That's what the question was. Do they hydrate the body?
I think they definitely hydrate. Well, I think what they do is they enhance the emptying of the stomach. And they actually, I offer the carbonated drinks, the soda water to people to help with the stomach and help to empty the stomach, make the stomach feel better. A I've had very good results with that. It certainly hydrates, as well as it's a light. It can actually alkalinize just slightly because it's not as strong an acid as stomach acid, so therefore it'll alkalinize a little bit the stomach. So I have no problem with soda water at all.
Because I thought that basically the sodas from some of the research, carbonated sodas do not hydrate the body. This was from, I guess, one of the doctors. They do not hydrate the body, and that's kind of what I saw, that sodas do not kind of hydrate. And plus the sugar, and then if you're doing...
well, this is just soda water. If you're going to have a soda with sugar in it, like a 7-Up or a Sprite or something like that, that's a whole different type of thing.
Yeah.
Soda water itself is different. Now, if you have the sugar in there, you could argue that a lot of things can happen when you start drinking the carbonated soft drinks with the sugar. And the fructose is difficult for the liver to metabolize, so it's better not to have the high fructose corn syrup. I have a patient. This is an amazing story. He's a Vietnam vet, and he came in with terrible arthritis. He had the dioxin sprayed on him and so forth. Anyway, over a period of 3 years, he now has lost 150 pounds. He's lost his diabetes. He's lost his blood pressure. His hemoglobin A1C, the indicator of diabetes, was 11 when we started, and it was just measured recently at 4.9.
And can you back up just a little bit, because for our listening audience, so they can start asking for a hemoglobin A1C, can you just back up and explain to them what that test is? It is a blood test, but can you kind of just let them know why we do that test? Mm-hmm.
We do the test because what it does is it measures the amount of sugar that's attached to membranes. In this case, the red blood cell membrane. So as the sugar rises in the bloodstream, and the longer it stays at a certain level, a certain amount of sugar will attach to some of the carbohydrates of the membrane, or some of the proteins of the membrane. So what happens is that level of sugar percent that's attached can be measured. Over 120 days, about a third of the population of the red blood cells are replaced. So the hemoglobin A1C gives me a rough measure. About every 3 or 4 months you can measure it and see that the person is going down or up with the amount of sugar that's attaching to the red blood cells, which reflects the average blood sugar that they are living with on a day-to-day basis. So the higher the A1C, the higher the average blood sugar. In his case, he had an 11%, so he had a very high, somewhere in the 250 range, average blood sugar per day. Any one time you could check his sugar and find some number or some level, but his average was about 250, giving him the 11%. Because he lost 150 pounds, he lost his insulin resistance. Because of his dietary and lifestyle changes, he does not. In fact, I was riding with him in the car one day, and I said to him, I said, how did you do this? How did you get this weight down like this? Because I want to know. So he turned to me while I was driving the car. He turned and looked at me, and he says, I don't eat sugar.
Yes.
And I went, geez, that's amazing. I just listened to it and said, okay, that's my next goal, is to not, or to minimize. I'm already backing up already. Minimize. No. Don't minimize. Just don't eat sugar. I mean, even just trying to do that for a few days is more of a challenge than one can believe.
Yes,
sugar
it is.
Mm-hmm. It is. It's so when I start people out with nutrition, I say, okay, well, go here, do the vegetables, do the fermented foods, do any of the meats you want, and then, but these are not processed meats, and then have a little bit of low glycemic fruits. And that's kind of what I ask them to eat the first 3 to 4 weeks and see how they feel. Even there's a little bit of sugar in that, but he literally has broken the record by going to this point where he doesn't eat sugar. He eats very little fruit. There's a book called Diabetic Solutions, which is actually very good. I don't like some of the ideas he has, but his overall, he tells the truth. This is an MD that's a severe diabetic. He basically just says, look, in order for me to manage this without insulin, I can't eat foods that call for insulin. And so he doesn't eat fruit. He hasn't had fruit in 40 years, which to me is a little bit extreme, but that's what he's worked out for himself.
But he works it out for himself, because what works well for one person, but as long as you're watching your levels and exercising and getting your sleep, if that works well for you, then that's great. Because they do have the 21-day raw food diet too for diabetics, but a lot of people can't adhere to raw food for 21 days.
Exactly. It's all your choice, and work with your provider to find a solution that's very comfortable for you.
Yes.
Now, nutritional products. We talked briefly about nutritional products. They're not all created equal. If you're going to buy something from some companies, you're not going to get, as I told the story, I think, last time about how Dr. Bronstein had an iodine product that he knew didn't have iodine. And when he tested it, and then he sent it out to a third party that he tested, the certificate came back, no iodine in the bottle. Now, just like vitamin D, iodine could prevent breast cancer or prostate cancer. So that company they're becoming irresponsible by not providing what they say they provide on the bottle.
Yes.
And actually life can be at stake depending on the person. Maybe not everyone, but there'll be that person who takes it expecting it to do what it's supposed to do, whether it's vitamin D3, which also helps prevent breast cancer, helps prevent various types of infections. In Finland, it helps prevent diabetes in adolescents. They give 1,000 units of vitamin D to their children, the little babies, infants, for that first year of life, and there's like a 78% reduction in diabetes in adolescents, which is like, okay, that's incredible.
That's amazing. This
vitamin D.
Right, and this is all so great, and I just got the word. I think we're down to almost our last 15 seconds of the program. So, Dr. Mathis.
What a wonderful show.
If you can kind of wrap it up real quick, because I know we're really out of time. I just want to say that you have covered so much information, and I just want to make a point, because you were on a guest before, really quick here, as far as lab testing. By the time your lab tests show that there's a problem, the problem has been there for a long time. By the time your provider has told. And this is something that you brought out as a guest one day. So I want to say that, each one teach one. The show will be archived, so you can go to the Cherilyn Lee Health Show.fm and send your friends to the show to listen to this show if they missed it today. It will be up on YouTube by Thursday. So please share the show. Go to the Cherilyn Lee Health Show.fm and share this with your friend. We want to thank you so very much for taking the time to be with us today.
Thank you.
It's just amazing, your wealth of information. We'll be bringing you back again very soon. But thank you so much for taking the time today, Dr. Mathis.
Well, thank you very much.
Thank you. And as I always end my show, and I want to thank my co-host, Belinda Foster.
Thank you.
Our PR specialist and co-host of the Cherilyn Lee Health Show. Thank you so much. If you have any questions, you can always, Dr. Mathis, can you please give out your phone number or website, please?
Yes, okay. The website is baselinehealth.net, and that's baselinehealth.net, and the phone number is 805-570-4400. 805-570-4400.
Thank you so much. And if you want to reach us here at NutriMed Integrated Healthcare, you can reach us at 310-419-4300. And again, thank you so much for joining us today, the Healing Frequency Interlight Radio. God bless you and have a wonderful day. Repeat after me, please. And thank you for sending me all your miracles that have happened. I am so grateful that I am a magnet
for
miracles.
Miracle.
Have a wonderful and blessed week.